My name is Sonja Meiers, and I'm a professor and graduate programs director at Winona State University in Rochester, Minnesota. I'm going to talk a little bit today about a strategy that I've used with students in the graduate programs, particularly those students who are working on their thesis. And so the title of my presentation today is Clarifying Family Constructs Through Evolutionary Concept Analyses. And the subtitle, Mentoring Graduate Students in the Use of the Rogers Method to Build Family Nursing Science. First, a little bit about me. My background clinically is that I'm a pediatric nurse. I was in pediatric nursing practice both in the acute care setting, school-based setting, parenting education, and then home care for medically fragile children for about 15 years before I began teaching at Minnesota State University, where I taught 19 years, and now I teach at Winona State University, which is one of the 7 state university system colleges and universities in Minnesota. My true passion for family nursing began when I was caring for medically fragile children. Now, you would think it would be when I was in pediatric nursing for 15 years in the acute care setting, and I knew about families. They were the context of care there. That was very clear to me. But when I began to be in the home of the child and understand that I was a temporary guest, it was much more clear to me that nurses had to do a much better job of caring for the family, because we also were, it also was clear to me that what I was doing mattered in terms of the health and the stress load on the family itself. So that's where I really got interested in family nursing care. And my study of family nursing began, of course, a little bit more in my master's program, but then substantively in my doctoral program at the University of Minnesota, where Patricia Short Tomlinson was my advisor, and she continues to be my mentor today. So I would say, beginning really with the doctoral work, that my expertise is in the nurse-family interaction, the nurse-family member interaction, specifically the meaning that's constructed within that interaction. I also am fond of examining and trying out different family study methods, family research study methods, and measure development. Measure development specifically initially started with the Family Nurse Caring Belief Scale, which Dr. Tomlinson is the principal author on that particular measure, and then working with a group of nurse researchers from the Minnesota State University Mankato, where we've developed the Family Illness Experience Visual Analog Scale. So just kind of dancing both sides of the world of family nursing with nurses and with families. My current projects, I'm a co-investigator on a Healthy Immigrant Families project, working together to move more and eat well, and that's a National Institutes of Health funded study for 5 years, where we're using community-based participatory research methods with Rochester Healthy Community Partnership, that's where I live, Rochester, Minnesota, working with families who are immigrants and refugees from Cambodia, from Spanish-speaking countries, Somalia, and the Sudan. We have created, along with their assistance, a family-focused intervention, and it will be delivered by a bilingual family health promoter. So we're in the first year of that 5-year study, or actually on to the second year. I'm also principal investigator in a study called The Centrality of the Parent-Provider Relationship in Parent Appraisal of Child Pain that I'm doing with colleagues in Italy. So we do a lot of Skyping for that particular project. And then a co-author, I'm an author, a single author and co-author in some book chapters in a textbook that will be coming out soon in the spring of 2014 by Denham, Eggenberger, Crumwoody, and Young, which is a text really about family-focused nursing to enhance the ability of undergraduate students and undergraduate faculty to think family in nursing care. But the study the strategy I'd like to talk to you today a little bit about is the strategy that we've used with graduate nursing students, and that is a method of doing secondary data analysis. And the secondary data analysis is being done on some 72 interviews from a primary study testing the reintegration in chronic illness for families model that I've developed with Eggenberger, Crumwood, Glismer, and Earl. And so that primary study was done in 2011, but these are secondary secondary data analysis on the interviews with these 72 families. What we've done is randomize these transcripts, and each group of thesis students, which is a group of 3 students, has access to the de-identified data. And that de-identified data really, we do a random numbers selection of those transcripts, so it's across the spectrum. These are across the spectrum of illnesses, across the spectrum in terms of types of illnesses, but the particular groups that we've looked at thus far, we have both families of children and families of adults in the sample, but we are just focusing right now on families of adults. So my first group of students finished that project this spring, and during that project what they've done is I joined the group of 3, and we do a content analysis of the transcripts looking for some specific attributes of identified concepts. Those concepts are underlying the Family Illness Experience Visual Analog Scale that I talked about a little bit earlier. And in that visual analog scale, we looked at things like family perception of burden, family caring strategies, family vulnerability, family pondering, family struggling, family financial burden. And those particular concepts, though we had initially defined them for the measure, we kind of wanted to do an evolutionary concept analysis, which Beth Rogers talks about being much more akin to how nurses do their work, because it has transitioned our understanding of many concepts in health, and certainly with families, transitions over time. So what we're doing is looking at these particular transcripts for how families define their experience of chronic illness, and the students have gone to the literature to create a definition of, for instance, I'll just say family burden, or let's go with family struggling, because there's a lot about family burden, but family struggling through the process of chronic illness. They look for the antecedents, the things that come before, the attributes, the things that it looks like when you see it, and the consequences, the things that happen after the concept. And for those particular concepts, then we have the antecedents, attributes, and consequences. We focus from then on, after having that clarified, we focus from then on the attributes. So struggling, we look for the attributes of struggling. So struggling, kind of a push-pull experience, or pondering is another one that we've talked about. And for instance, the definition of family pondering is reflecting upon the past and potential future meaning of the illness in family life, and analyzing the impact of the illness on the family. That's the definition that's been created. Then we look within the transcripts for statements that the families say that are reflective of that kind of concept. We're purely looking for, does it exist as we've defined it, and have we missed any of the attributes? So are there some we should add, or are there some that even across these 10 randomly selected transcripts we don't see at all? And then we would use that to define the concepts. This particular thesis group took their poster to the Midwest Nursing Research Society annual conference, and were ribbon winners of within that graduate student poster contest. So of course I'm very proud of that experience. And now we're continuing on with 2 other groups, and they are looking at the remaining 6 concepts within the measure. So by the end, we believe that we will have some really strong underlying conceptual definitions for the measure, the Family Illness Experience Visual Analog Scale. What I can tell you from the students' perspectives is that they get turned on and very excited about being theorists, which is a very tall order, and they get really good at it. So it's a great strategy to use. So thank you for sharing in my project today, and best wishes in your work in family nursing.